Hello, my name's Austin Snowden. I'm Professor of Mental Health here at Edinburgh Napier University, and it's my pleasure to introduce you to the course here, the Bachelor of Nursing 2020 for Adult Mental Health, Child and Learning Disability Nursing. This presentation is mainly for the first years, but I am aware that some of our clinical colleagues will be watching this as well. But I just wanted to let you know that this recording is primarily for our first year students. So if any of you clinicians want to know more at the end, or if any of you students want to know more at the end, I'll leave my email and you can get in touch with me then. But what I want to do in this presentation is take you quickly through the programme, tell you a little bit about the Nursing and Midwifery Council, how they support us and how they generate the standards that underpin the programme. And then I'm going to go through the theory content of our programme and touch on some of the practice content as well. Now, all of this information is in much more detail within the individual modules, which I'm going to mention here. This is just a very high-level overview, just to give you an idea of what to expect in the course. Okay, so, and there will be links at the end as well, so that you can follow this in your own time. The NMC Standards of Proficiency are the standards that underpin our programme. The Nursing and Midwifery Council is our professional body, and they set the standards for education, and we take those standards and we turn them into a programme of education. Just a quick overview of the principles running through the programme. There are 12 modules in all, theory modules, plus the practice modules that you do. And there are some themes that go through every module, but don't necessarily have a module in themselves. And that's what these 4 themes are. So everything is about research and evidence. So you need to understand, how to be critical about the evidence when it's presented. And that's one of the main themes. There is actually a module on it as well. It's very, very important. Interprofessional learning. These days we work together with social workers, physios, OTs, doctors, you name it, we work with them. And so increasingly we don't work in isolation. And so interprofessional learning runs through the whole course as well. Pharmacology is there because I suppose hopefully you'll all want to become nurse prescribers after you finish this course. And the nurse prescribing course can be quite a significant jump from registration. So a lot of the pharmacology needs to be put back into the course, and we've done just that, you'll be delighted to know. So pharmacology goes through all the modules as well, as does professional and clinical skills development. We want you to be lifelong learners and take responsibility for your own learning, and that's why this theme runs through the course as well. In terms of what we're actually teaching, they're expressed in these 7 platforms, and these do form the basis of your practice assessment documentation. And that's about being an accountable professional, promoting health, preventing ill health, and you can see the rest there. To look at them in detail, they're all in this document, Future Nurse Standards of Proficiency for Registered Nurses. And there is the link to it, and there's what it looks like inside. So, for example, that promoting health and preventing ill health proficiency is articulated through a list of outcomes, and then in your practice assessment documentation, you will then demonstrate competence against these particular outcomes. There's also these 2 annexes as well, which is essentially a set of specific skills and procedures that you need to be competent in as well. How does all that get assessed, I hear you say, and that's fortunate because I've made this slide. What happens is in practice, you have a practice supervisor and a practice assessor. And whilst you're in university, you have an academic assessor. And just to tell you a little bit about these individual roles, the practice supervisor can be any registered health and social care professional working in a practice environment. So, for example, you might be placed in a social care facility, in which case any registered social care professional there could be a practice supervisor for you. The practice assessor, by contrast, has to be a registered nurse, and the easiest way to think about it is that they're on the same field of practice as yourself. The NMC specified that it can be an appropriately equivalent experience. So for example, you could be on a mental health placement, be a mental health nurse, and your practice assessor could be an adult nurse who just happens to have an extensive experience of working in mental health, for example. And finally, your academic assessor also has to be on the same part of the register as you, or with that equivalent experience caveat again. But just to add a bit of spice into the mix, you can't keep the same academic assessor all the way through your program. So we'll probably change between the first and second year, and then the second and third year, just to keep it interesting for you. And for our clinical colleagues, there's a lot of information is now online and will be in what's going to be called the Practice Learning Centre, and that will replace the Mentor Centre as mentors are phased out and practice assessors and supervisors are phased in. I hope that makes sense. As for our actual strategy for assessment, we do something called authentic assessment here, and I'm very pleased we do as well. So rather than just doing essays for everything, you do a whole different range of different things for your assessments, hopefully aligned with the module that you're doing as well. So, for example, we've got a module in the second year called Working in Health and Social Care Teams, and the assessment for that is writing a referral letter. Okay, so that's both an assessment for your module and hopefully a skill which you'll use in practice. That's the idea. So your assessment matches the work. The NMC break down the learning journeys into these high-level descriptions: developing confidence, developing independence, and expressing confidence and independence. So by year 3, you'll be independent and confident so that you can lead nursing care for a group of people, including people with deteriorating health and escalating ill health appropriately. Now, that might sound extremely scary now, but you'll be fine by then because you'll have had the first 2 years first. And first year is about developing confidence. So just now, this year, you'll be learning all the basis of nursing practice, the underpinning evidence, engaging with people, their families and carers, and learning all about both person and family-centred care. And in the second year, you carry on with that, but you develop a bit more independence in the second year. So you become a little bit more critical about the information that you're learning, and you begin to initiate and prioritise nursing care for commonly encountered conditions. Okay, so that's the high-level pedagogy, if you like, of how you turn from where you are now into a registered nurse after 3 years. So this is a slide of the whole course, and I know that you can't see that. So I've printed it out, and it currently exists on the 4th floor at Sight Hill as a poster. So one day, hopefully, you'll be able to come in to Sight Hill, go up to the 4th floor and look at that beautiful poster, which has all the details which I'm missing out just now about the programme. Okay, so it's all there. I'll also leave a copy in PDF form on the site here as well. But for the purpose of this presentation, I've just really simplified that into these 12 modules over the 3 years. And of course, we've got the practice learning that goes alongside the theory all the way through. So understanding body systems is just that. It's about understanding how the body works. So it's anatomy and physiology and so on. Caring for self and others comes next. And that's obviously you need to be able to take care of yourself first and understand yourself first before you can care for others. So that's what that module is about. The third module in Try 2 is developing identity and role in XX nursing. And where it says XX in this slide, that just refers to your particular field. So it could be adult, mental health, child, learning disability. This is very much one program, but all the 4 fields take the same modules, but they do have a slightly different angle on them where it's specified as a field particular module. And the final one for year 1 is about assessing community and patient wellness. So that's about looking at those inequalities that I was talking about before, for example, and issues of public health and so on. And these are, I've already mentioned the assessments briefly. Just to give you a little bit more detail about the first year, the Understanding Body Systems is assessed by a multiple choice question. There is a portfolio of evidence that you gather to fulfill the assessment for caring for self and others. Developing identity and role in mental health nursing is just 3 short essays of 500 words each that you need to fulfill for that. And assessing community and patient wellness is just a presentation. So these are all the assessments, and more detail of this obviously is in every module descriptions on Moodle. But just to quickly highlight a couple, we hope to go back to the observed structured clinical examination. That's what this is. The students really like this after they've finished it mainly, but it's about doing an observed clinical examination in practice. So you would interact with a patient and ask them various questions, and that's how that exam would work. And here, for example, managing complex care in nursing, well, a case study comes out of that. So you can see how we've tried very hard to make the assessments fit with the content and the theory that we're teaching. As for the practice learning, you will do that both online, simulated in our skills lab, but mainly in practice. And that'll all be timetabled, and the timetable will also be on this Moodle site. Mainly takes place in hospital, community, but also social care and other placements, wherever nurses work these days. It's not all casualty anymore. So just to say that the assessment for that I've already spoken about, but the evidence of proficiency that you gain is written by you into your practice assessment documentation. Now, the practice assessment documentation is online, and you don't start it until Try 2, so please don't worry about it. And you will have a lot of lessons on it, a lot of sessions teaching you how to find it, what sort of evidence needs to go in it, and so on and so forth. And for our clinical colleagues as well, there's the Practice Learning Centre, which will help you help the students, hopefully. So after all that, in 3 short years, there you are, a registered nurse. And that's a picture of me when I first decided to become a nurse. And just to finish off, there's some useful links on the site. I'll go through in a separate screencast how to navigate Moodle and everything, but there's some useful links there, and obviously I'll put those on the site as well. So thank you very much for listening and good luck with your studies. You can download this presentation and peruse it in your own time. It's called BN Introduction and Overview, the PowerPoint as well as the video, so you can download this and have a look at it anytime. And thanks very much for listening and good luck with your studies.